So we have the cartilage on the end of the bone, which is kind of like the tread on a tire. I've said that a bunch of times here, but you have to visualize that. And then underneath the cartilage is bone, because the cartilage is on the end of our bones. And so that's called the subchondral, below the cartilage bone, the subchondral bone. That bone starts to get soft. Think of it like a road too, like the surface of a road. You have the asphalt, which is kind of like the cartilage, if you think of it that way, to use a different analogy. And then you have the underlayer of the road, the stone, all the packed stone, all that stuff. That's like the bone. If that underlayer washes out or gets soft, what's going to happen to the asphalt? It's going to break down, and you're going to get a what?
Sinkhole.
A pothole. Yeah, exactly. So you're going to get a pothole, and that is what arthritis is. If the cartilage doesn't have a supportive bone underneath it, the bone is soft, it's going to start to break down, and you're going to get a pothole, which is a more severe form of arthritis rather than just slowly wearing down. And so the only way to see if these soft spots or stress or microfractures, we like to call them, are there present in the bone is by getting an MRI. You can look at an X-ray and you can see the bone nicely, but you can't see if there's any stress or microfractures because it's microscopic. So an MRI is going to show that. So a lot of people think, oh, I need to get an MRI to see if there's a cartilage tear. Yes, it will show a cartilage tear or a ligament tear, a sprain, an ACL tear, things like that. But we especially love to use MRIs, especially if someone has arthritis and we already know their cartilage is going to look terrible, or at least part of it is. But we want to look at the underlying bone because if that's an issue, that's something that we need to take care of and try to reinforce and firm up so that the cartilage that's remaining doesn't continue to break down. And so the bone is very, very important. Now, the bone also has millions of pressure sensitive nerve fibers. So as the bone breaks down faster than the body can heal itself, you get these little stress or microfractures, and bone has millions of pressure sensitive nerve fibers, so it hurts. So most of the pain from arthritis actually comes from the bone, not from the cartilage. Cartilage doesn't have any nerve fibers in it. Now, if the joint gets inflamed and swollen, the joint casing or capsule will stretch and give you some pain. The meniscus cartilage is attached to the capsule, the casing around the joint. If that's torn, it can cause pain. But cartilage just in and of itself does not cause pain. So the wear of the cartilage isn't going to give you pain. It's when the stress starts going to the bone or the joint starts getting inflamed and swollen that you're going to notice pain.